5 important tips for rheumatoid arthritis sufferers. Managing rheumatoid arthritis, RA, can be challenging, but with the right strategies, you can improve your quality of life and reduce the impact of the disease. Here are 5 important tips for rheumatoid arthritis sufferers. Consult with a rheumatologist. Consulting with a rheumatologist is a crucial step in managing rheumatoid arthritis, RA. Here's a more detailed overview of what you can expect when consulting with a rheumatologist. Referral. In many healthcare systems, you may need a referral from your primary care physician to see a rheumatologist. Discuss your symptoms and concerns with your primary care doctor, who can then refer you to a specialist if necessary. Medical history and symptoms. During your initial consultation, the rheumatologist will conduct a thorough review of your medical history. Be prepared to discuss your RA symptoms, including when they first appeared, their severity, and any factors that make them better or worse. Physical examination. The rheumatologist will perform a physical examination focusing on the affected joints and other relevant areas. They will assess joint tenderness, swelling, range of motion, and signs of inflammation. Diagnostic tests. Depending on your symptoms and physical examination findings, the rheumatologist may order various diagnostic tests to confirm the diagnosis and assess disease activity. Common tests include blood tests. These may include tests for markers of inflammation, e.g., C-reactive protein, or erythrocyte sedimentation rate, rheumatoid factor, anticyclic citrullonated peptide, anti-CCP antibodies, and complete blood count, CBC. Imaging studies, X-rays, ultrasound, or MRI scans may be used to visualize joint damage and inflammation. Joint fluid analysis. In some cases, the doctor may aspirate fluid from an affected joint to check for signs of inflammation and infection. Diagnosis and treatment plan. If RA is diagnosed, the rheumatologist will discuss treatment options with you. Treatment typically involves medications, and the choice of medication will depend on the severity of your RA and other factors. Common RA medications include non-steroidal anti-inflammatory drugs, NSAIDs, disease-modifying anti-rheumatic drugs, DMARDs, and biologic agents. Your rheumatologist will explain the benefits, potential side effects, and risks associated with each treatment option. In this segment of the video, I kindly request you to subscribe to my channel, where we share valuable information about nutritious foods. Additionally, please consider activating the notification bell and giving the video a thumbs up. Your support holds significant importance for us. Monitoring and follow-up. RA is a chronic condition that requires ongoing management. Your rheumatologist will work with you to develop a treatment plan and schedule regular follow-up appointments to monitor your progress, adjust medications as needed, and address any new symptoms or concerns. Lifestyle recommendations. In addition to medication, your rheumatologist may provide guidance on lifestyle changes, including exercise, diet, and stress management techniques to help you manage your condition more effectively. Questions and communication. Don't hesitate to ask questions and voice your concerns during your consultation. Effective communication with your rheumatologist is key to ensuring you receive the best care and understand your treatment plan. Second opinion. If you have any doubts or concerns about your diagnosis or treatment plan, don't hesitate to seek a second opinion from another rheumatologist. It's important to have confidence in your healthcare team. Remember that managing RA is an ongoing process, and working closely with a rheumatologist who specializes in autoimmune diseases can make a significant difference in your quality of life and long-term outcomes. Medication. Adherence. Medication adherence is a crucial aspect of managing rheumatoid arthritis, RA, and other chronic conditions. It involves consistently taking your prescribed medications as directed by your healthcare provider. Here's a more detailed look at medication adherence for RA sufferers. Understanding your medications. Start by fully understanding your medications. Know the names of your medications, their purpose, dosages, and any potential side effects. Ask your healthcare provider to explain why each medication is prescribed and how it fits into your overall treatment plan. Follow your treatment plan. RA treatment often involves a combination of medications, which may include disease-modifying anti-rheumatic drugs, DMARDs, nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and biologics. Some medications are taken daily, while others may have different dosing schedules. Follow your treatment plan diligently, taking the right medications at the right times, and adhering to any specific instructions from your healthcare provider. Keep a medication schedule, develop a medication schedule, or use a pill organizer to help you keep track of when to take your medications. Some people find it helpful to set alarms or reminders on their phones. If you have a complex medication regimen, consider using a medication management app or talking to your pharmacist about blister packaging, which organizes your medications by date and time. Communicate with your healthcare provider. If you experience side effects or have concerns about your medications, communicate openly with your rheumatologist or healthcare provider. They can adjust your treatment plan or recommend alternatives if necessary. Never stop or change your medications without consulting your healthcare provider, even if you believe your RA is under control. Sudden changes can lead to disease flares. Refill prescriptions on time. Ensure that you always have an adequate supply of your medications. Don't wait until you've run out to request a refill. Consider setting up automatic prescription refills with your pharmacy to help you stay on track. Organize your medications. Keep your medications organized in a designated area. Store them away from direct sunlight, moisture, or extreme temperatures, as some medications may be sensitive to these factors. Dispose of expired or unused medications properly as recommended by your healthcare provider or local guidelines. Seek support. If you find it challenging to remember or manage your medications, don't hesitate to seek support from family members, friends, or caregivers. They can help remind you to take your medications as prescribed. Joining a support group for RA sufferers can also provide you with valuable tips and motivation to adhere to your treatment plan. Regular follow-up appointments. Attend all scheduled follow-up appointments with your rheumatologist. These visits are essential for monitoring your progress and making any necessary adjustments to your treatment plan. Remember that medication adherence is critical for controlling RA symptoms, preventing joint damage, and improving your overall quality of life. It's essential to work closely with your healthcare team and address any barriers or concerns that may affect your ability to adhere to your treatment plan effectively. Exercise regularly. Regular exercise is an essential component of managing rheumatoid arthritis, RA, as it can help improve joint flexibility, muscle strength, and overall well-being. Here's a more detailed look at incorporating exercise into your routine when you have RA. Consult with your healthcare provider. Before starting any exercise program, consult with your rheumatologist or healthcare provider. They can provide guidance on suitable exercises and any precautions you should take based on your specific condition and limitations. Tailor exercises to your needs. Work with a physical therapist or an exercise specialist with experience in RA to develop a personalized exercise plan. They can help you choose exercises that target your specific needs and adapt the program as your condition changes. Choose low-impact activities. Low-impact exercises are generally more joint-friendly for people with RA. These activities put less stress on your joints while providing cardiovascular and strength benefits. Examples include swimming, water aerobics, stationary cycling, and walking. Warm up and cool down. Always begin your exercise session with a gentle warm-up to prepare your muscles and joints for activity. This may include light stretching or range of motion exercises. After exercising, Cool down with stretches to improve flexibility and reduce muscle soreness. Strength training. Incorporate strength training exercises into your routine to build muscle and support your joints. Start with light weights or resistance bands and focus on proper form. Target all major muscle groups, including the ones around your affected joints, to provide better joint stability. Aerobic exercise. Engage in aerobic exercises to improve cardiovascular fitness. Activities like brisk walking, cycling, or using an elliptical machine can help strengthen your heart and lungs. Gradually increase the intensity and duration of your aerobic workouts, but listen to your body and avoid overexertion. Balance and flexibility. Exercises. Incorporate balance and flexibility exercises to improve joint range of motion and reduce the risk of falls. Yoga and Tai Chi are excellent options for enhancing balance and flexibility. These exercises can also help with stress reduction, which is beneficial for managing RA symptoms. Pacing and rest. Understand your limits and pace yourself. It's essential to strike a balance between staying active and not overdoing it. If you experience pain or excessive fatigue during or after exercise, take breaks or rest days as needed. Consistency is more important than intensity. Listen to your body. Pay close attention to how your body responds to exercise. If you notice increased pain, swelling, or other symptoms, modify your exercise routine or discuss it with your healthcare provider. Stay hydrated and maintain proper nutrition. Drink plenty of water before, during, and after exercise to stay hydrated. Proper nutrition is also crucial for supporting your overall health and energy levels. Adaptive aids and assistive devices. Consider using assistive devices such as orthotics, braces, or ergonomic equipment to make exercise more comfortable and joint-friendly. Stay motivated. Find activities you enjoy and vary your routine to prevent boredom. Exercise with a friend or join a group class to stay motivated and accountable. Remember that consistency is key when it comes to exercise and RA management. Start slowly, gradually increase your activity level, and be patient with yourself. Regular physical activity can help reduce pain, improve mobility, and enhance your overall quality of life when living with rheumatoid arthritis. Balanced diet and weight management. Maintaining a balanced diet and managing your weight are important aspects of managing rheumatoid arthritis, RA. A well-planned diet can help reduce inflammation, support your immune system, and improve overall health. Here's a more detailed look at how to achieve a balanced diet and effective weight management. When living with RA, consult a registered dietitian. Consider consulting a registered dietitian who specializes in autoimmune conditions or rheumatoid arthritis. They can create a personalized dietary plan tailored to your specific needs, taking into account any dietary restrictions or preferences. Anti-inflammatory foods. Focus on incorporating anti-inflammatory foods into your diet. These include fruits and vegetables, especially colorful ones like berries, leafy greens, and tomatoes. Fatty fish, rich in omega-3 fatty acids, nuts, seeds, and whole grains. These foods contain antioxidants and nutrients that may help reduce inflammation. Omega-3 fatty acids. Omega-3 fatty acids found in fatty fish, e.g., salmon, mackerel, and sardines, flax seeds, walnuts, and chia seeds, have been shown to have anti-inflammatory properties. Consider including these sources of omega-3s in your diet. Limit processed foods. Reduce your consumption of highly processed and sugary foods, as they may contribute to inflammation. These include sugary snacks, soda, and foods high in trans fats. Maintain a healthy weight. Achieving and maintaining a healthy weight is crucial for managing RA, as excess body weight can increase stress on your joints and exacerbate symptoms. If you are overweight or obese, Consult with a dietitian or healthcare provider to develop a weight management plan that includes a balanced diet and regular physical activity. Portion control. Pay attention to portion sizes to avoid overeating. Eating smaller, more frequent meals throughout the day may help you better manage your weight and blood sugar levels. Stay hydrated. Drink plenty of water throughout the day to stay hydrated. Adequate hydration is essential for joint health and overall well-being. Consider food sensitivities. Some individuals with RA may have food sensitivities or intolerances that can exacerbate symptoms. Keeping a food diary and working with a healthcare provider or dietitian can help identify and address potential trigger foods. Medication and nutrition. Be mindful of potential interactions between RA medications and certain foods or supplements. Some medications may require specific dietary adjustments or restrictions. Discuss this with your healthcare provider. Balanced meals. Aim for balanced meals that include a variety of food groups, including lean proteins, e.g., poultry, tofu, beans, whole grains, e.g., brown rice, quinoa, whole wheat, and healthy fats, e.g., olive oil, avocado. Supplements. Discuss the use of supplements with your healthcare provider or dietitian. Some people with RA may benefit from supplements like vitamin D, calcium, or fish oil, but it's important to determine individual needs based on blood tests and dietary intake. Dietary adjustments for medications. Some RA medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, may be harsh on the stomach. Eating a meal or snack before taking these medications can help reduce stomach irritation. Remember that dietary changes may not result in immediate relief from RA symptoms, and their effects can vary from person to person. It's essential to work closely with your healthcare team to create a comprehensive plan that includes diet, exercise, and medication management to effectively manage your rheumatoid arthritis and support your overall health. Pace yourself and manage stress. Managing stress and pacing yourself are critical aspects of coping with rheumatoid arthritis, RA, effectively. High stress levels can exacerbate RA symptoms and make it more challenging to manage the condition. Here's a more detailed look at how to pace yourself and manage stress when living with RA. Recognize stress triggers. Identify specific situations or factors that trigger stress in your life. These triggers can vary from person to person and may include work-related stress, relationship issues, financial concerns, or health worries. Stress reduction techniques. Practice stress reduction techniques regularly. These may include deep breathing exercises, progressive muscle relaxation, mindfulness, meditation, yoga, or Tai Chi. Experiment with different relaxation methods to find the ones that work best for you. Consistency is key to reaping the benefits. Time management. Effectively manage your time by prioritizing tasks and setting realistic goals. Avoid overcommitting and learn to say no when necessary. Break larger tasks into smaller, more manageable steps. Use tools like to-do lists, calendars, or smartphone apps to help you stay organized. Balanced lifestyle. Strive for a balanced lifestyle that includes adequate rest, regular exercise, and a healthy diet. Ensure you get enough sleep each night, as sleep deprivation can increase stress and pain levels. Seek support. Don't hesitate to seek emotional support from friends, family, or a therapist. Sharing your feelings and experiences with others can be cathartic and help alleviate stress. Consider joining a support group for people with RA to connect with others who understand your challenges. Set realistic expectations. Accept that living with RA may require adjustments to your daily routines and expectations. It's important to set realistic goals and not be too hard on yourself when you can't do everything you used to do. Pacing activities. Practice. Pacing by breaking tasks or activities into smaller, manageable chunks and taking regular breaks. This can help prevent overexertion and fatigue. Listen to your body and pay attention to pain or discomfort signals. If you start to feel fatigued or experience pain, it's crucial to stop and rest. Adaptive strategies. Incorporate adaptive strategies into your daily life. For example, use ergonomic tools or assistive devices to make tasks easier on your joints. Consider modifications to your home or workplace to reduce physical strain. Time for relaxation and enjoyment. Dedicate time for relaxation and enjoyable activities. Engage in hobbies or activities that bring you joy and help take your mind off your RA. Cultivate a positive mindset and practice gratitude to help counteract stress. Professional help. If stress becomes overwhelming and begins to affect your mental health, seek professional help from a therapist or counselor who can provide coping strategies and support. Medication management. Ensure you take your RA medications as prescribed. Effective medication management can help control inflammation and minimize disease-related stress. Managing stress and pacing yourself is an ongoing process. It's important to be patient with yourself and recognize that there will be good days and challenging days. By incorporating stress management techniques and pacing strategies into your daily life, you can reduce the impact of stress on your RA symptoms and overall well-being. Regular communication with your healthcare provider about your stress levels and their impact on your condition can also be beneficial in managing your RA effectively. If you found the information valuable, we'd appreciate it if you could show your support by liking the video and sharing your thoughts in the comments. To ensure you never miss our upcoming useful content, consider subscribing to the channel and activating the notification bell. Our dedicated team is committed to enhancing your well-being and helping you lead a healthier life. Thank you for being part of our community, dear viewers.